Hey guys, it's me, Jax. So got a few life updates to give. Let's see. Trying not to make this too long because nothing humongous is happening that I can really elaborate on just yet. If you're friends with us on Facebook, Beth and I, we've moved into our own place. We got a 3-bedroom townhouse. Yeah, we're still in Shelbyville. Pretty much probably going to stay here for a while, if not a very long time. Sorry about the noise of the paper. Well, one of the things is I've known I needed to have a surgery to have an ovary removed because I have a very large cyst. Well, about a month ago, I went to the female doctor and they told me that it wasn't a cyst, it was a tumor. Okay, stop in the tracks, but it looks benign, but they're not sure till it's out. Well, they told me I would need to get the very large cut across my lower area. I didn't like that. I wanted a second opinion. Another doctor came in, said, well, there's a 50-50 chance we could do it laparoscopically, but there's still the chance that we may not because it is so big. So I said, well, I want a third opinion because they were only going to take out the one ovary, knowing that a cyst is growing on the other one now also. They said that was still healthy and they wanted to keep that in. Well, they finally get me into University of Louisville. So I go there today, and I'm there. The doctor that came in, Dr. Pasic, said, okay, you're transgender. So I told him. He said, do you want to do a full hysterectomy? I said, yeah. I have pain. I can't stand the pain anymore. I think it pretty much went without saying when he actually did the exam that he knew I was not kidding about the pain. Because I actually screamed and started to cry with the pain. Sorry to hear the noise. The people are outside landscaping. But so I am scheduled for my full hysterectomy, and it came to be there was a lot coming up in the next few months. Hold on. Hey guys, sorry about that. The phone rang. But as I was saying, we have a lot coming up in the next few months. Doctor's appointments. Beth needs to have a surgery that will heal her up faster than mine possibly will. Because I actually need to stay in the hospital overnight with getting the full hysterectomy. Beth's telling the weed whackers to shut up. But, yeah. So, what I scheduled was my pre-op appointment for October 13th. I have to be there at like 10:30. I think it says, yeah, 10:30. And then surgery will be on November 3rd. I have to be there at 5:30. So what I have to do is schedule with the medical cab company. Once all that's scheduled, then I can go ahead and tell them, hey, you're not going to be picking me up that day. You're going to be picking me up the next day. I have to stay overnight. It's going to be all day and night. they did say that the surgery can take anywhere from 3 to 5 hours. Yay. I don't think I like being unconscious that long, but oh well. Another thing, because my last video was really low because I was still healing, and it was like 3 or 4 o'clock in the morning when I made it. What I was saying in it was I had my gallbladder removed. Was healing up at that time. I was diagnosed with a TBI, which is a traumatic brain injury. And to top it all off, when I was diagnosed with that, I went from regular glasses to prism lenses, which, as you can see on the sides, are really bad. The right side is where the injury is the most. So that's what's been causing pretty much most of my seizures. That, food additives, new medications. So everything I take, if it causes a seizure, I have to stop it right away. That has caused me to have restless leg syndrome also with the head. So pretty much every night I go unconscious because of this pill I take. I'm on Neurontin for that. It works really well, but thing is, you couldn't wake me up off of it if you tried. But yeah. So on the 27th we moved into our place. Well, we signed the lease. On the 28th we moved in. We have a 3-bedroom townhouse. Really nice hardwood floors. We've hung up some stuff already. I'm gonna take pictures and put them on my Facebook. What I do plan on doing is revamping the Facebook sales site with some of the new stuff we have, and taking pictures that are on there down and going through and seeing what we have and putting that stuff up. So I want to revamp it up so that it's all the stuff we have and I can take it off once it sells. Or Beth can. Because we're going to be doing it with both, not just Facebook, but eBay too right now. That's until it's decided whether or not I get disability, because I have applied again. Because the eye doctor that diagnosed me with the TBI has originally stated that I can't work. But I can do 1 to 2 hours a day of volunteer work, which I need to do 8 hours a month to live where we live. So I'm going to try contacting a few shelters and see which is closest and try from there. Okay guys, I gotta merge the 2 videos now. Talk to you later.